Hello everyone. Today, we're delving into the world of a medication called Ocrelizumab, commonly known by its brand name, Ocrevus. As always, this discussion is intended for educational purposes only, and if you have any health-related questions or concerns, please seek guidance from a medical professional. Description: Ocrelizumab, marketed under the brand name Ocrevus, is a medication used to treat multiple sclerosis, MS. It falls into the category of disease-modifying therapies, DMTs, and is designed to slow down the progression of this chronic autoimmune neurological condition. Ocrelizumab was approved by the FDA in 2017 and has since become an important option for managing certain forms of MS. Ocrevus is primarily prescribed for relapsing forms of MS, RMS, which include relapsing remitting MS, RRMS, and secondary progressive MS, SPMS, with relapses. Additionally, it is approved for the treatment of primary progressive MS, PPMS, making it the first and only DMT with this indication. The way Ocrevus works is by targeting specific B cells in the immune system, reducing their activity, and thus slowing down the immune system's attack on the protective covering of nerve fibers, known as myelin, in people with MS. This can lead to a reduction in the frequency and severity of MS relapses, as well as potentially slowing down the progression of disability associated with the disease. Warnings: before considering Ocrevus as a treatment option, there are some important considerations and precautions to keep in mind. It's essential to discuss with your healthcare provider if you have any known allergies to Ocrelizumab or any other ingredients in the medication. Furthermore, individuals with active hepatitis B virus, HBV, infection should not use Ocrevus due to the risk of reactivation of the virus. Before starting Ocrevus, it's crucial to inform your healthcare provider of any current or past medical conditions, especially if you have a history of infections, as Ocrelizumab can increase the risk of infections. Additionally, if you are pregnant, planning to become pregnant, or breastfeeding, you should discuss this with your healthcare provider, as the use of Ocrevus during pregnancy and breastfeeding should be carefully considered. Side effects: like all medications, Ocrevus can have side effects. Some common side effects may include infusion-related reactions, which can include symptoms such as fever, chills, nausea, headache, and fatigue. These reactions typically occur during the infusion process and can be managed by healthcare professionals. Other potential side effects may include upper respiratory tract infections, skin reactions, and a heightened risk of infections in general, such as respiratory tract infections and herpes. It's essential to report any unusual symptoms or side effects to your healthcare provider promptly. Ocrevus may also affect the ability of the immune system to fight certain infections, which could lead to more severe infections. It's important to follow your healthcare provider's guidance on vaccinations and preventive measures to reduce the risk of infections while on Ocrevus. Interactions: Ocrevus may interact with other medications or treatments, so it's crucial to provide your healthcare provider with a comprehensive list of all the medications, supplements, and herbal products you are currently taking to avoid any potential interactions. Dosage: the dosage of Ocrevus is typically administered through intravenous, infusion. The treatment consists of 2 initial infusions, given 2 weeks apart, followed by maintenance infusions every 6 months. The specific dosing schedule and frequency may vary based on individual patient characteristics and the type of MS being treated. Your healthcare provider will determine the most appropriate dosing regimen for your condition. It's essential to adhere to your prescribed dosage schedule and attend all recommended infusion appointments to ensure the medication's effectiveness and safety. Avoid: during Ocrevus treatment, it's advisable to take precautions to minimize the risk of infections. This includes practicing good hygiene, avoiding close contact with individuals who have contagious illnesses, and following your healthcare provider's guidance on vaccinations. FAQ: one common question about Ocrevus is whether it is suitable for all forms of MS. Ocrevus is primarily approved for relapsing forms of MS, RRMS and SPMS with relapses, and primary progressive MS, PPMS. Its use in other forms of MS may not be as well established, so it's important to discuss treatment options with your healthcare provider based on your specific diagnosis and medical history. Closing: that concludes our overview of Ocrelizumab, known by its brand name, Ocrevus. Always remember that this information is intended for educational purposes and should not replace professional medical advice. If you have any questions or concerns about Ocrevus or its use in your specific case, please consult with a healthcare provider. Thank you for joining us today.